because you have plates that you're bending and are weakened, because it's harder to get something exactly where you planned it, and because in traditional ways you're depending on the teeth as your landmarks for positioning the skeleton. All those challenges basically taught the surgeon to compromise on their plans, right? Because if you have all these things where you're afraid things are going to go wrong, if you're fighting tension, if you're not going to be able to make that movement, all those limitations from traditional surgery, then a responsible surgeon is going to say, I'm not going to go for the touchdown, right? I'm going to go for the field goal. And so the planning, even when I learned, was if someone needed a centimeter forward, instead of making that centimeter forward where they optimally should be, we compromised. We split the difference because we knew that this is going to work and the other one is, I don't know. And that's how almost all surgeons are taught to plan, because it's really based on the limitations of the technology. Now I know that wherever I need to take someone, I know that it's going to work. I know it's predictable, stable. My risk of relapse or problems or complications are way lower. So my planning now, it's like a team that has a good quarterback. You know you can go for the touchdown, you go for the touchdown. So the plan is different. You're not going for the field goal in that situation. And I know it's an analogy, but in a lot of ways, this is actuality in a surgeon's decision-making process. If you have the tools to take you to the right place, you can plan accordingly. So thankfully now, and that's, if you look at my cases in traditional a long time ago versus now, the planning evolves too. Now I know that function is key. And like you said, form follows function. So you give someone the optimal airway. A lot of time that's going to be a bigger movement than surgeons were comfortable making in the past, and why you see. And I'll look at Reddit too. I'll look at a lot of posts, and I'll see people that are under advanced all the time. I'll look at Instagram posts from other surgeons, and I always say, man, these guys should be more forward, you know. And it's just, that was how they were taught, and it's really a limitation. You know, they're making the right call based on the technology that they're using. But now when I plan, you're right. I'm going to look for airway as a key, because that's number one. That's number one priority. You got to breathe, because if you're not breathing, then like you said, you're going to be in pain from muscle function and all these other things. You're going to age faster physiologically. You're going to get sicker. So priority is airway, and everybody's different. So we use things like the full facial anatomy, their airway, their individual airway needs, their body habitus, to know, like, okay, this person needs so much of an advancement. And then because we're able to plan and because of experience, then I'm going to take into account facial aesthetics and harmony to kind of fine tune that plan from there.
If your colleagues were to describe your surgical approach, would they describe you as conservative or more liberal or aggressive when it comes to advancing?
My movements, if you go by numbers, compared to traditional and most surgeons, are definitely going to be on the aggressive side. For
Yeah,
sure.
you're going to win a lot of fans with that kind of talk on my channel, Doctor.
Yeah, but if you look at my cases, most of them, they're all coming forward, and I'm going to make appropriate movements. And when I give lectures, that's what I say. I tell them I'm going for the touchdown because I have the quarterback.